Abhishek, hey, let's start here. For many of us, we've been hearing a lot about India. Man, could you kind of give us an update on how things are going in India, and in light of COVID? And then on the heels of that, would love to hear you say a little bit about, in light of what you're experiencing there, what does abundance look like?
Thank you, Cohen, and glad to be here. In fact, Angie was supposed to be here today, but due to some emergency, she hasn't been. So I'm filling in for somebody who's much more cohesive and comprehensive and much better face. So I try my best to fill her shoes. But um, India, you all would have heard in different medias as to what we were going through. The second wave hit us really bad, and it started somewhere end of March and beginning of April. And we had about between 400,000 to a half a million cases every day coming in. And the number of deaths were more than 5,000 per day. And these are just the registered number. One of the epidemiologists from Michigan University, Dr. Mukherjee, mentioned that the the estimates could be as much as 15 times more than the numbers that we are getting. So the scenario was such that everywhere or every day, every hour, it was
Mm.
scary to pick up your phone and look at your messages, because
Mm.
you would either get messages of someone really, really sick, or someone needing help, or someone dying. And one of the biggest thing that hit us was one of the treatment lines of COVID is to get oxygen. And we found ourselves in a situation where you breathe oxygen every day, but people were running around to get oxygen for their loved ones so that they can breathe. And if I move down to Delhi, Delhi is a city which is about 100 square kilometer, roughly about 70 square miles or so. And we have about 25 million people living in this city. So you can imagine the density of how we live. And it was bound that if one person gets COVID in the family, you don't have space to isolate yourself. Isolation was a luxury. And once somebody gets in your family, and it just passes on. So when the second wave hit us, we were at about 2% positivity rate, and within 10 days it rose to 36%. So every 100% being tested, 36 were testing positive. And that was the amount of what we call as the wave happened in Delhi. And it's it's much better now. We've again come down to about 2% positivity rate, but that's because the city is closed right now. There is no movement. You have to be inside your house. None of the businesses are opening up except for the essential services. You can just go out, and only grocery shops are open. So we are in a stage where, as long as we are inside, we are safe. But as soon as we move out, uh, I think it can just come back again. And when that kind of wave happened, Delhi itself, we were getting about 28,000 cases every day, and our hospital system had completely collapsed. And when our family got it, we were just uh, dependent on what we can do in our house, how we can treat ourselves within the house, because going to hospital was not an option. One of the things that I remarkably saw was that when COVID wave started hitting us, every 5 minutes you would hear an ambulance siren going around. And then over the course of 1 week, the sirens were quieter. Not because the cases were going down, but because there were no more ambulances, there were no more hospital beds, and there was no way, an ambulance can help you. The number of people outside the hospital were more than the number of people inside the hospital. And with the number of deaths happening, we had 6 to 8 hours wait in a queue of dead bodies for cremation. So you have to wait for your turn with your loved one, just to find a place to cremate your loved one. So that's the kind of thing that we experienced in last 45 days. And uh, in spite of the fact that the infection rate have come down, positivity rate has come down, but deaths are still happening, because those who got sick, some are uh, getting okay, but some people are still struggling. And then we have the black fungus hit us now. So people who had diabetes and who got um, COVID and then were treated with steroids are now struggling with another. It is now classified as an epidemic called black fungus.
Yes.
So even if you've recovered of COVID, people are dying of black fungus, and we are seeing white fungus and yellow fungus also coming up. And we don't have antibacterial drugs for it. And yesterday I heard the president of the United States saying that about 50% of the US population has been vaccinated by now. So that was a landmark. In India, we are at 3%.
Mm.
So
Mm.
we are still prone to be hit by COVID, and we are bracing ourselves for uh, the third wave, which is supposed to be somewhere around the corner. But amidst all this thing, Con, you asked a very beautiful question about how do we see abundance. When you see abundance in everything negative, you know, hospitals are full, cremation grounds are full. How do you see the positive abundance? And we saw that. We saw
Mm.
positive abundance in abundance during the time when we were, you know, most badly hit. Uh, the Geography of Grace book says that when you're at the most bottom, that's where you find the abundance of grace. So grace is like a stream flowing downstream, and it accumulates at the very bottom. And when we were at the very bottom, we experienced abundance, and that was in the people of Delhi. So when the hospitals were struggling for oxygen, when hospitals had run out of oxygen, we had common people using their cars, driving 4 hours,
Hallelujah.
5 hours outside of the city to some oxygen plant, which is not even meant for medical oxygen, but they opened up to provide oxygen for people. And you know so many people would just go fill up those oxygen cylinders. These are big heavy oxygen cylinders. You don't have any infrastructure to pick them up and things like that. People were actually carrying them on their shoulders, putting them in their cars, bringing it back to people here. And a lot of faith based communities really came forward, and I would highly appreciate the Sikh community. You know,
Mm.
what they did was they converted parking lot into what they call as oxygen langar. Langar is basically a word used for food, where
Mm.
you serve free food to people who need food.
Mhm.
But they converted the parking lots, the hospital parking lots, the parks in the neighborhood into oxygen langars. So their volunteers would go as far as they can, find oxygen, bring it back here, and people would drive in their cars or in auto rickshaws or in any means that they can reach this place, and they would be served oxygen in a way that could help them breathe. So it was beautiful what was happening, in spite of the
Hallelujah.
fact that people were struggling to breathe. But there was a breath of hope that was being.
Mm.
And then uh, gurudwaras, churches, mosques, and temples opened up and made isolation centers. Now, like I told you in the beginning, that we are a densely populated city. People live in one room houses or one bedroom houses where 5, 6, even at times 10 people live. So if one person gets positive, you don't have an option to isolate. So these places opened up as isolation centers. So anybody who gets positive goes and stays in these centers. They are free of cost. You don't have to pay anything there. You get food, you get care. And so those were the abundance that we saw
Amen.
during these COVID times. And even now, when things have been a little better, I would say, we are seeing act of random kindness. People would just, those who have means would just bless people without means. Like the definition I still couldn't get the exact words what Dave said about,
Yeah.
but it exactly fit to what's happening here. That people are doing things without them asking or
Mm.
really expecting or anticipating, just helping people with random act of kindness. So that's what's been happening here in Delhi, and yeah, we see people coming together and trying to make a difference in the city.
Hmm. Go ahead, Dave.
Well, Abhishek, just again, thanks so much for both your work and your report. And I know you know this, but the LF organization has been in prayer for you, and of course Sam down in Bangalore, and just the continent of India as a whole. So really appreciate that.